Today in KIMS, Krishna Institute of Medical Sciences, our beloved Health Minister Lakshma Reddy has come and inaugurated the bone marrow transplant wing. The bone marrow transplant, in the human body, all our blood cells, that is the red blood cells, white blood cells, platelets, everything will be generated from the bone marrow, which are from the flat bones in the body. It's called sternum and ilias, other bones. Sometimes when there is any disease in the bone, either in the bone marrow or in the blood cells, the blood cell count will come down drastically. We can, if it is only an acute case, we can supplement it. Suppose if there is a bone marrow issue, we cannot able to do either cure by the medicines or by transfusing more and more blood cells. We need to do a transplant. When we want to do the transplant, there are two types of transplants, autologous transplant or homologous transplant. If we take out our all blood cells, we can able to churn it in a machine and purify it, and then we can able to transfuse ourselves. Otherwise, we will take some other somebody's bone marrow of a same group. We can able to transplant into our own bone marrow transplant. But this procedure looks maybe simple, but it is a very highly demanding as far as the infection rate is concerned. All our infection are fight barriers or the white blood cells. When that has been come down, our immunity will come down in our body. So when the immunity comes down, there is every chance even a mild infection will become a major infection. So to control that, we need to have a very dedicated, isolated place. That's what we created, about 15 suits at Krishna Institute of Medical Sciences with 100% HEPA filters. HEPA filters means where the outside air that comes into the air conditioned area, into the room, if you keep on recirculating, again the infection rate will go up. So every time we will take 100% fresh air, cool it, and again we will send it back, so that there will not be any recirculation of the air. So the airborne infections will come down, and at the same time the infection rate of that particular patient will come down. Mainly all these transplants we will give immunosuppressive drugs to prevent any rejections. So when we are giving an immunosuppression drugs, already the immunity in the body has come down. By adding these drugs, again the immunity will come down. That's why we need to protect this patient. Infection-free zone, that's where we have been opened today. So in that room, suppose some of the times this patient will become sick, then we need to transfer into an ICU, then again lot of patients will be there, cross infections will be there. That's why all these 15 suits we have been created like infection free. That means if we want to ventilate, I can ventilate in the same room. We can convert that room into an intensive care unit. If there is a requirement of dialysis, we can also do the dialysis for that particular patient there only. So from day he admitted, from there he can able to discharge totally by in that room only. He need not be, otherwise in all other departments, the patient, if there is sick from the ward, we will shift to the intensive care unit. From there when we will go back to the room. Here everything will be done there. There is no need of any shifting of this patient. This facility will be hardly found in this country in any hospitals. Creating a same room as an intensive care unit and treat them with 100% oxygen, with HEPA filters, and then send the patient home. Even the creation of a dialysis unit also there is a very important tool which we have done today, and we are very happy that it has been inaugurated by our Honorable Health Minister of Telangana, Dr. Lakshma Reddy Garu.